Morning everyone, my name is Nav. Today I'll be teaching you about manual pulse measurement. Before I begin, I would like to tell you that you'll be acting as first year student nurses. Is that okay?
Yeah, that's fine.
Okay, so the aim of this session is to demonstrate the importance of manual pulse measurement. So by the end of the session, you'll be able to safely perform an accurate manual pulse measurement, recognize the normal and abnormal limit, and locate areas where a pulse can be obtained.
Yeah.
So, before I begin, does anyone know what do they mean by the term pulse?
Me?
Yeah. You raised your hand.
Oh, did I? Sorry. I'm not sure.
Okay, so a pulse is the number of times a minute that a heart contracts or beats. It varies from person to person. It is low when you're resting and higher when you're exercising. Yeah.
What's the normal?
We'll go through that on the next slide, so take it easy. It's also a vital part of a cardiovascular assessment. So why do we need to take pulse? Does anyone know?
We need to take pulse because it's a measurement of the cardiovascular performance.
And just to explain on that, it's to see how well your heart's working and to help find the causes of symptoms such as chest pain, dizziness, irregular or rapid heart rate, and also to check the blood flow after an injury when the blood vessel may be blocked, and also to check your general health and fitness levels. So we're going to talk about normal and abnormal heart rate. So the average pulse rate is between 60 to 80.
Okay.
Many factors will affect the pulse, such as illnesses and patient's health. Regular heart rate is steady and even, whereas the irregular is very uneven, and some beats are stronger while some are missing. So as you can see, this is a regular heart rate picture. So you can see it's very consistent.
Yeah.
Whereas, compare that with this, you can see some beats are missing and some beats are louder. So it's a bit inconsistent.
Thank you.
Does anyone know the medical term of low heart rate and high heart rate?
Ducky and Barky.
Yeah. So
No, you need the full term.
Sorry,
bradycardia.
Is it still right though?
yeah, that's fine, yeah. So bradycardia, which means low heart rate, usually below 60 beats per minute. The causes of bradycardia is such as aging, any disease that damages your heart's electrical system, medications such as beta blockers. So if patients on a high heart rate, we need to treat them with beta blockers. Symptoms are lightheaded, shortness of breath, dizziness, loss of consciousness, and you might find patients confused as well. Tachycardia is abnormally high fast heart rate. Usually above 100 beats per minute. So the causes for this are smoking, alcohol, if you get recreational drugs such as cocaine, or any heart-related disease. Symptoms is fast pulse, palpitation, chest pain, dizziness, and confusion. So how to measure a pulse? The most common way to measure pulse is on your wrist. This is also
Do you need a volunteer?
Can I have Calvin to step up, please? You can do
Yes.
that. You can sit here.
What is your name?
Calvin.
So if you place your two fingers on the, are you doing on your left hand yet? So if you place two fingers on your artery here, this is the radial artery, and then count for 1 minute until you feel your beat. So let's just pretend that he's counting. So what was your answer? What was your results?
60 that I'm
60.
fit and healthy.
So is that normal for you?
Yes, it is.
Some people do it 30 seconds and then times that by 2. So I found that very inaccurate, so that's not a very nice, good way to count. I've got an activity for you here. So if you could take a minute or so to write down the medical terms for the pulse locations point. So what's number 1?
That is your head.
Do you know the medical
No,
term?
I'm
It's
not
called temple.
Temple.
Yeah. You know number 2? It's on the neck. You've got a medical term for this?
Is that your jugular?
No, close, but it's the carotid artery.
Carotid.
Number 3, it's around here.
I'm not sure what that
Brachial.
Brachial.
Artery.
Yeah.
So when you do the blood pressure measurement, you often see nurses using a stethoscope to find the brachial artery. Number 4, which is
Femoral.
yeah. So for this one, you have to be really careful because you have to take the patient's consent because it's a very sensitive area, so you need to respect their privacy and dignity as well. Number 5
I'm not sure what that is.
is called, I believe it's called, I can never say this, but
Pedile.
correct me if I'm wrong, popliteal?
Oh,
Popliteal.
Popliteal. Oh.
Popliteal.
Popliteal.
Number 6, which is located on the center of your heart, this is known as the apex.
Apex.
Yeah. And the one we just done, which was
The artery.
the radial artery.
Brachial.
And finally, there's one on the foot, which is called the
Toe artery.
pedal artery. Pedal artery.
Pedal.
So you can go back to your seat, Calvin. Thank you for your
Thank you.
participation.
Let's give him a hand.
So to give me one moment. So to read, you should be able to safely perform an accurate manual pulse. You should by now know an abnormal and normal limit, and you should know the locations around the body, the pulse location around the body.
Yeah.
Here are a few references which you might find interesting and further reading. Thank you. Any questions?
Yeah.
Yeah.
What would you do if someone has a high pulse?
First, you will do a cardiovascular assessment. So this will contain a pulse, an ECG, just to check for your heart's electrical activity. If it's a very high heart rate, you will treat the patient with beta blockers, which slows the heart rate down, such as bisoprolol or digoxin, and then you will assess the patients. You will also ask the patient if they smoke or drink, any medical related history.
Out of those locations, which one's the most reliable to take a...
Very good question, Kelvin. The most reliable, I'm not sure whether reliable, the most common is the radial, because that's the most easiest to find. Obviously with the femur, like I said, you have to be careful with the patient. That's normally for patients with vascular disease, the femur one. The neck one is mainly used for the CPR.
Right.
So when you see a patient lying unconscious, they're not breathing, so you check for the carotid pulse. But yeah, the radial pulse is the most common, and that is the most reliable if you do it manually.
Okay.
That is.